everyone, welcome to my YouTube channel that is Vlog by Dentist. Today we'll talk about sequelae of malocclusion or unfavorable sequelae of malocclusion, or what are the things you have to face when you have malocclusion. So, as we all know, normal alignment of teeth not only contribute to the oral health but also goes a long way in the overall well-being and personality of an individual. Correct tooth position is an important factor for aesthetics, function, and overall preservation of restoration of dental health. But whenever we talk about malocclusion, there is some sequelae related to it. And today we will talk about those sequelae that are related to malocclusions. So the first we will enumerate them and then we will talk about them one by one. The first sequelae of malocclusion is poor facial appearance. The second one is risk of caries, predisposition to periodontal diseases, psychological disturbances, risk of trauma, abnormalities of function, TMJ problems, and these are the 7 sequelae of malocclusion. And now we will talk about them one by one. The first one is poor facial appearance. Malocclusion is capable of adversely affecting the facial appearance of an individual. Here you can see this is the class 1 and you can look at the facial appearance of this person, and this is the class 3 and you can see the facial appearance of this person, and here you can also consider the facial appearance of this person. When you compare the facial appearance of this person, you can easily understand that malocclusion can cause poor facial appearance, especially when it is related to skeletal malocclusion. So this was the first sequelae of malocclusion. Now we will talk about the second sequelae of malocclusion, that is risk of caries. Malalignment of teeth make oral hygiene maintenance a difficult task, thereby increasing the risk of caries. It may also reduce the potential for natural tooth cleansing, thereby increasing the risk of decay. Here you can see in the picture, there is a malocclusion. Lateral incisors are posteriorly placed while central incisors are anteriorly placed. This reduces the capability of a person to brush correctly. Here you can see the plaque accumulation because there is less capability of person to brush properly, and also the malocclusion decreases the potential for natural tooth cleansing by saliva, so it increases the risk of caries. So whenever a patient has a malocclusion, it increases the risk of caries for the patient. This was the second sequelae of malocclusion. Now we will talk about third sequelae of malocclusion, that is predisposition to periodontal diseases. Malocclusion is associated with poor oral hygiene and a frequent cause of periodontal diseases. In addition, teeth are placed in abnormal position can be a cause for traumatic occlusion. Here you can see when the teeth are in direct contact, so the normal forces of teeth can cause traumatic occlusion. And also crowding can cause one or more teeth being squeezed buccally or lingually. Here you can see this teeth is squeezed lingually, so making that out of investing bone, resulting in reduced periodontal support like in this teeth. And traumatic overbite can also lead to increased loss of periodontal support, and therefore another indication for orthodontic treatment. So we on the short term we can say that malocclusion can cause periodontal diseases. First by traumatic overbite, there you can see there, and the second by when the tooth is placed buccally or lingually from the investing bone, it reduces the bone support and periodontal support for that tooth, and that leads to increased risk for periodontal diseases. So this was the third sequelae of malocclusion. Now we will talk about the fourth sequelae of malocclusion, that is psychological disturbances. Malocclusion that adversely affects the appearance of person leads to psychological disturbances. Unsightly appearance of teeth make a person highly self-conscious and turn him into introvert. Thus, treatment of malocclusion in such patients has been improving the mental well-being and confidence. And now we will talk about the fifth sequelae of malocclusion, that is risk of trauma. Teeth that are severely proclined are at a high risk of injury, especially during play or by accidental fall. Here you can see these teeth are proclined and these are posterior placed, so these teeth that are forward from their position uh, increase the chances of injury to these teeth. And also when there you can see the traumatic overbite because of upper incisor, that can also cause the reduced periodontal support, and this may lead to the trauma to occlusion. Next category of malocclusion is abnormalities of function. Many malocclusion cause abnormalities in the function of somatognathing system, such as improper deglutition, defects in speech, improper respiration, etc. Here you can see this is a malocclusion patient. You can quite recognize the functional problem because the problem will be in sizing. Here you can see that there is a cross bite, so the problem will be in chewing. But as compared to that malocclusion, if we see at the normal occlusion or the ideal occlusion, we see there will be proper chewing and proper incising of the food. So whenever there is malocclusion, it also impairs the ability of function of somatognathing system. The next category of malocclusion is TMJ problems. Malocclusion associated with occlusal prematurities and deep bites are believed to be because of TMJ problems such as pain and dysfunction. So we can say that the most important malocclusion problem that cause TMJ problems are, first one is occlusal prematurities and the second one is deep bite. These are the two malocclusion problems that increase the load on the temporomandibular joint and thus increase the risk of TMJ problems associated with malocclusion. So this was all about the sequelae of malocclusion. Thanks so much for watching our video. Don't forget to like, share, subscribe and comment, and if you want a video on certain topic, kindly let us know and we will make it for you. Thanks so much.